never miss a video from the aesthetic clinics and Dr. Debraj Shome.
So Nidhi is on Insta. You can follow her on Facebook as well, Nidhi Belani. And a lot of the people who've joined today are people who would like to go ahead and become cabin crew now and in the future. Being a cabin crew is part of the hospitality industry, and becoming a cabin crew is becoming more and more competitive every single year. Having good skin and good hair is non-negotiable for all of us, but especially for cabin crew, it's very, very important indeed. So while Nidhi writes down the questions, what we did is we did an Instagram live right now where Nidhi also actively participated. We were there for an hour. And now we are here for the Facebook live session. For some reason, we are not able to figure out how to get her online. But nonetheless, that doesn't matter. I'm sure that she will type the questions in and we can. So one of the questions which ended up coming in here was Rahul Patel, who said, "Sir, what are the side effects of medicines for acne and scars in near future?" Acne is a very difficult to solve problem. Acne has a multifactorial etiology, which means that it occurs because of various reasons. Hormones or improper hormones are a very important reason for developing acne, and therefore acne tend to occur mostly in your late teens or early 20s till your mid 20s or so. If you're developing acne, I don't think there's any solution. You'll have to see the doctor. But nonetheless, the few things which work in most types of acne is if you're overweight, please try and reduce your weight, because if you're overweight, it tends to increase the chances of polycystic ovarian syndrome, especially in women, and that in turn can lead to the acne going ahead and becoming worse. Exercising regularly also helps. If you exercise regularly, aerobic exercise has been shown to open the pores, and the sweat can also remove all the toxins which are required. And going ahead and making sure that you don't burst your pimples is also very, very important, because if you burst your pimples, they will leave you with poor acne scars, which in turn will look worse. So Rahul, the answer to your question is there's no point in telling you about the side effects. Most medicines have side effects. The challenge is to use them in such a way that the side effects are minimized and you get the best possible effects from the same. Nidhi, in relation to your question, how to deal with open pores. Open pores are an extremely difficult to treat problem. Open pores tend to occur on the skin because we have a breakdown of the collagen in the skin. Actually, open pores are a way of the skin to tell you that basically people are going ahead and aging, that your skin is aging. And if your skin is going ahead and aging, then to take care of the skin becomes even more important. It's the disorientation in the lattice framework of the collagen fibrils within the skin which makes the skin develop open pores. Open pores are a difficult to solve problem. The best way to prevent them is to use sunscreen regularly, to take care of your skin by toning, moisturizing, and using sunscreen even when indoors, so that it does not go ahead and develop these open pores. Once the open pores have come in, then one of the lasers that we have, which is called the carbon dioxide laser, they can do a very good job because they can go deep and produce collagen within the skin itself, and by virtue of producing collagen, they can make the skin pores appear much better over a period of time. So prevention is the best, but you can also go ahead and make sure that you take care of that. Is laser treatment for hair removal safe? Anjali, hi. Laser treatment for hair removal is extremely safe, not only for cabin crew but for others as well, and it's very, very simple and easy nowadays. I think waxing is so yesteryear. It is possible to do either the Nd:YAG laser or the diode laser, and you can actually go ahead and remove the laser remove hair so easily. Reduction of hair can occur by more than 90% in most patients. You will require 8 to 10 sessions, but if you can go ahead and take care of the hair on your body permanently, why would you want to do any waxing? Now, the next question comes in from Umashesh Prarthi and Dr. Sandeep Jeste. How, Dr. Sandeep, how are you? So, their question is treatment for acne scars. Acne scars has been a difficult to solve problem for a long period of time. But it gives me great pleasure to let you know that over the last 6 years, the aesthetic clinics has worked very deeply in research in acne scars. And we find that a combination protocol of 3 things: subcision, fillers and carbon dioxide laser multiple sessions can go ahead and make the skin appear much better and can reduce the acne scars by more than 80%. This paper is getting published in a top American journal as we speak, and we might not be able to remove acne scars completely in many patients, but we can reduce it to a very significant degree in majority of our patients, Dr. Sandeep. What are the best solutions for dark circles? That's Nidhi now. Dark circles are a big problem. One of the major reasons we are having so much dark circles is because we are exposed so much to these devices. These devices go ahead and release, the LEDs release light, which exacerbate and excite the melanocytes, leading to further pigmentation. Plus, many of us are not sleeping regularly. Many of us don't go ahead and have proper hydration. We do not have proper sleep. That leads to worsening of the dark circles. Depending on the dark circles and why it's happening, if it is because of loss of volume of the under eye area, we can actually inject fillers. Fillers are injections which are made up of hyaluronic acid, which is the same constituent of your skin as your skin. And hyaluronic acid is extremely safe. It is very safe for you to actually go ahead and use the hyaluronic acid fillers. You will see a lot of actors and actresses who are 65 and 70 looking like they are 30, and many celebrities who are looking like 30 throughout their lives. They will make you believe it's due to the yoga. It may not be because of the yoga. It may be because of the fillers as well. So that is the important thing to remember. Nidhi, thanks for saying that to Anjali. Nidhi is saying that she's done laser for hair removal. It has reduced her hair growth and is absolutely safe. In fact, you can remove the hair almost completely now. It's almost a non-painful procedure. Diode laser is slightly painful, but the Nd:YAG laser is almost non-painful, and it can be used wonderfully to go ahead and remove the hair. Rahul, thanks for your question. We have branches in Mumbai, and we are also there, not all the time, but we are there on a rotational basis in Kolkata, Hyderabad, Bangalore, Ahmedabad, and New Delhi. And in these cities, we are there once every alternate week. So you will be able to find us at any of these cities after the lockdown. You can write down to us and we can take care of that from there. Umashish wants to ask about treatment for age-related pigmentation. Thanks for your question. Pigmentation at any age is a big problem. Especially in women, pigmentation mainly occurs because of hormonal problems. So melasma is a very important cause of pigmentation. If there are hormonal issues, there will be pigmentation. So most women tend to develop pigmentation, especially after childbirth, because that's when the pigments change, and that's what causes pigmentation, especially in the cheek and the malar areas. And treatment of that is very difficult, but we do use a combination of skin creams and pigment removal laser to make that pigmentation much better. Nidhi, any other questions that you wanted to take? So I just wanted to let everyone know, whoever's on this particular call, I just wanted you to know that we are going ahead and making this a routine thing. We will be doing this once every couple of weeks in order to try and give you all more information. And Nidhi and I will also be organizing online classes for the cabin crew to allow them to become a little bit better at understanding their own problems and being more aesthetic. So Nidhi, we deal with hair fall related issues all the time, and hair fall related issues can be treated through multiple mechanisms, which can be used at the counter or available in the pharmacy. We also have our own patented treatment called the QR678. The QR678 has a US patent, has an Indian patent, and has Indian FDA approval. And this is now being utilized in multiple countries very safely. The QR678 is a therapy which involves small mesotherapy injections to be given in the scalp wherever there is lack of hair. And this works really well for hair fall related issues, both in men as well as women. One of my favorites, Dr. Madhav Rao, is here, a very renowned vitreoretinal surgeon from Dubai. Hi Madhav, good to see you. Hi Abhijit, good to see you as well. So Zuri Zarma wants to know the treatment for loose skin after 40. Zuri, thanks for asking the question. We are at an exciting time in human history. The exciting time in human history is such that we can all choose to look 30 all our lives. Whether you want to look 30 or you want to look your age, which might be anything more than 30, is your choice completely. But if you want to look 30 all your life, there are lots of non-surgical treatments. You should Google Althera. The Aesthetic Clinics is one of the only centers to have Althera in India. We also use a lot of other non-surgical techniques to tighten the skin up. So you can look young all your age, it's possible. And you can decide when you want to look young and how young you want to look, and we can take care of that. Anjali Sujit wants to know how to get rid of darkness around the neck. Anjali, we've spoken about darkness and pigmentation related issues. Pigmentation can be hormone related, and pigmentation can also have multiple other causative etiologies. Depending on the causative etiologies, we can go ahead and treat pigmentation through a combination of skin creams and through a combination of lasers, etc., which can be utilized to remove the pigmentation. Ms. Parveen wants to know how will you control hair fall. Now it depends on the reason hair fall is occurring. Up to 100 hair every day may be normal for it to fall. But if you have too much hair fall, or if you are getting a thinning of the scalp, there are lots of medicines which can help you. But it's difficult to really comment on it unless we examine. Like I said, we also have our own hair fall treatment, which is patented treatment, which can go ahead and treat it, which is called the QR678. Nidhi wants to know how are stretch marks different from normal scars. Stretch marks are a breaking of the skin collagen. So if we gain weight and then lose it, it tends to stretch suddenly, and this stretching of the collagen breakage and the breakage of the collagen leads to these white marks that develop on the skin. Stretch marks are extremely difficult to treat, Nidhi, but nonetheless you can make it better with carbon dioxide laser. So carbon dioxide laser is a long wave laser which goes deep and produces collagen on the face, and by producing collagen on the face or on the other parts of the body, the stretch marks can be made much better, but it's almost impossible to remove the stretch marks completely. Juhi wants to know, sir, I have ovary cyst, for that reason I'm becoming dark, and I'm only 26 but my skin looks very saggy. Juhi, I'm very sorry to hear that. Obviously, if there are hormonal problems, then things will become worse with your skin and your hair. If hormones are not okay, if the internal milieu is not fine, then externally it's very difficult to really keep the skin well. So we'll have to examine you and suggest ways to control it, but we might also need hormonal treatments in order to make sure that harm your skin in a bad manner and to take care of it. Nidhi wants to know, are acne back and the neck different from the one from the face, and how to deal with it? Well, no, Nidhi, acne on the back and the neck are almost the same etiology. Of course, there are certain specific differences which are very technical to discuss here, but more or less it's the same things. Going ahead and making sure that you exercise regularly, stay hydrated, solve any hormonal problems, and most important, do not prick or press the pustules, because that will lead to scarring and which might be very difficult to treat. Rahul wants to know that he was hurt by a sharp nail and he has an injury scar. Depending on the scar, Rahul, we can either go ahead and do a laser, or we can also go ahead and do other treatments which can be used for removing the scars, which can be surgery as well. So we'll have to see and then we'll take it. Juhi, very difficult to really talk about your ovarian cyst on a WhatsApp call or on Facebook Live. These Facebook Live sessions are made for very specific, very general queries. I suggest that you come in and get yourself examined by one of us, and then we might be able to better talk about medicines, etc. Don't want to commit myself on a call without examining you. Nidhi wants to know that she was once prescribed hormonal pills for acne. Would it have any side effects? The quick answer to that is yes, maybe. But then sometimes you might have to balance the benefits and the side effects. Anytime you give anyone a medicine, you have to balance the positives and the negatives, and then decide what needs to happen, and then take a call. So the answer may be different for different people, and the answer may be different for different conditions as well. Happy to take any more questions. We are running into the last segment of this, to be specific. So while healthy diet is important and healthy diet can go ahead and take care of skin problems to a large extent, there will be people who will still have acne and acne scars, and because it is genetic as well, and therefore utilizing medicines is very, very important. Nidhi wants to know how to deal with keloids and scars. Keloids are the hypertrophic scars which can also cause a lot of itching. Keloids, people used to believe earlier that keloids cannot be treated at all, but that's not true. you can actually treat keloids as well. We use either a combination of steroid injections into the keloid or a combination of steroid injections and laser and silicone sheets in order to make the keloids better, and they can be reduced. In certain cases, we also give radiation or radiotherapy to the keloids and then do a surgery as well. So there are multiple ways of treating it, and technology is evolving all the time, so it's better to make it, and it's possible to make it better. Anjali wants to know what are the reasons for blackheads. The reasons for blackheads are basically an obstruction to the pores and also a number of other reasons. Cleaning your skin regularly and going ahead and removing the blackheads with either some physical mechanisms or even certain other mechanisms which can sort of remove the pores, remove the blackheads through a blackhead strips, etc., can be a good way of doing it. But you should be careful about using blackhead strips regularly, because that can actually go ahead and make the pores wider, leading to more blackheads in the future. There is someone from Bangladesh. Namaskar, kemon achen? So I can speak your language as well. So good to see you as well. Rahul says, I'm consuming Reston 20. Do you recommend the same medicine to your patients also? Rahul, I've already answered that question. You cannot go ahead and give the same medicine to everyone. I know that everyone wants to get treatment on the internet because they don't want to pay doctors. You can come in for free treatment if you want. But the fact of the matter is, unless we examine you, taking some of these medicines can be we can't just go ahead and say, yeah, take Reston 20 or whatever on a call. That is extremely silly. Sorry, we can't do that. Now, Aditya wants to know the treatment for dandruff. Treatment for dandruff depends on the reason for the dandruff. The first thing that I want to tell everyone is, if you have dandruff, please stop oiling your hair. The more you oil your hair, the more you will get dandruff or seborrheic dermatitis in your scalp. See, normally also we have normal oil on our skin. The same skin which is there on your face is also continuing above on your scalp. So from that perspective, if we don't use oil on our face, why do we need to use oil on our scalp? So reduce that, and using a good anti-dandruff shampoo, we prescribe something like a Candid TV shampoo, and using that 3 times a week, applying it onto your scalp, keeping it for 5 minutes, and then washing it under running water will go a long way in reducing your dandruff. Nidhi wants to know, can vitamin E help with scar reduction and dark circles? Answer is yes, it will make it slightly better, but the slight may be hardly 10 to 20%. And you will need to do other things. Like I explained, dark circles have multiple etiologies, and therefore taking care of the dark circles is very, very important. But post-surgery scars, we do make it better with vitamin E, and it can become better. Anjali wants to know, keloids can have recurrence rate. Yes, keloids can have recurrence rate, but keloids are rare in the Indian population as compared to populations like the African population, and therefore in Indians more common is hypertrophic scars, and they don't tend to recur normally. Madhurima, one of my earlier patients, is here. Hi, good to see you, and hope you're doing well in the UK. So Nidhi wants to know how to avoid scarring from burns. It's a difficult one, Nidhi, how to avoid scarring from burns, but taking care of the initial burn by going ahead and using emollients, etc., may be a good thing to do. And you can remove the support the skin with petroleum jelly, lactocalamine, and use mild steroids as well. But different scars, depending on the depth of burning, we might have to treat differently before we can go ahead and prescribe anything. তীর্থাঙ্কর, অনেক অনেক ধন্যবাদ, আপনি ক্লিনিকের কথা কিছু জিজ্ঞেস করছেন, কিন্তু আই এম সরি টু সে আই ডোন্ট নো হাউ টু রিড বাংলা। সো কলকাতাতে কোথায় ক্লিনিক ওটাই আমি বুঝলাম বোধহয়, যেমন খুব ভালোভাবে বুঝতে পারছি না, কিন্তু কলকাতাতে আমাদের ক্লিনিক হলো কি সল্ট লেকে সেক্টর 3-তে। ইউ ক্যান রাইট ইন টু আস এট দি aestheticlinic.com, আর আপনাকে আমরা জানাতে পারি কোথায় এসে আপনার চিকিৎসা আপনি করাতে পারেন। Rahul wants to know, sir, what's the tattoo removal procedure? Rahul, there are multiple ways of removing tattoos. We use lasers to remove the tattoo, but like I have said in my Instagram live session, the one thing to remember is, do not go ahead and do a tattoo in the first place. Preventing the tattoo is the best way to making sure that the tattoo is not difficult to remove. It's much easier to put in a tattoo and much more harder to remove it, and certain tattoo inks like yellow ink, orange ink, golden colored ink, all of these are extremely difficult to remove and therefore should be used with great care. Hi Aparna, so good of you to join us. Aparna is a very well-known oculoplastic surgeon in Chennai, and she's also a great artist. So nice of you to join us. Madhurima, yes, your hand is looking so much better. Thank you so much. We remember that you were very, very worried post the surgery. Thanks for your patience, and good that your hand is now looking much better. The scars have healed well. It does become dry now. It does take some time post the surgery, maybe even a couple of years, because the nerves sometimes get damaged during the surgery, and that neuropathic dryness can take approximately a couple of years to go away. Please use a good hand moisturizer. You can use any brand like a Nivea, etc., and that should be fine. Thanks, Aditya, for thanking me. And Nidhi, what products are recommended for dry and oily skin? That's like a topic, Nidhi, that I can speak for the next couple of hours. Obviously, every one of us has dry skin, oily skin, or combination skin, and very, very difficult to really talk about it. But in general, you will go ahead and know that it's better in some ways to have slightly oily skin than have dry skin. Dry skin tends to age very, very quickly, and using moisturizing for dry skin is very, very important. But oily skin tends to age less, and so if you have oily skin, I say that you might have pimples, but you'll have less wrinkles as you age. Aarti wants to know, hi Aarti, thank you for joining us. Aarti is a very well-known celebrity beauty queen, and she's also a model, and she's one of my friends on Facebook. Thank you, Aarti, for joining us. Aarti wants to know some anti-pimple face serum for regular use, as she's getting a lot of pimples on her face. One of the reasons, Aarti, may be out, and also because you're not going out enough, maybe there are some hormonal issues, etc., or some hormonal imbalance. So I would say don't worry too much about it. You can just use a mild face wash, like a benzoyl peroxide added face wash, which can be used twice a day in order to make the face appear, the oiliness go away. But I would not suggest any long-term serum to be used on your face, since it is something which is happening only now at this moment in time. Just clean your face, get about 20 to 25 minutes of aerobic exercise, stop eating sweets and chocolates, and you should be much better, Aarti. You're a very pretty looking person, and I don't see the reason to put you on too many medicines. Hope that helps. Ms. Shabnam Syed wants to know, can you tell for puffy eyes remedy? Now, puffy eyes can be due to multiple reasons. If you mean the under eye fat bags which are there are multiple ways of treating these. In fact, I have a video on my YouTube channel, Ms. Shabnam. You can go to youtube.com/Dr. Debraj Shome. There's a video for puffy eyes. You can actually see that and see all the treatments, and you would understand that. Nidhi wants to know sunscreen for different skin types. My favorite sunscreens are Isdin Photoprotector and Ansolar, and they can be used for any skin type. You should be fine using it for every skin type. Okay guys, so it has been a great 43-minute session. We've had almost 100 people join us throughout this session. Nidhi and I will be doing this much more regularly, and I will be asking 2 questions now, and hopefully some of you who were not there, please, if you were there for the Instagram live session, do not go ahead and answer these questions. But if others want to answer these questions, you can, and we'll be giving away 2 free consultations because of you answering these questions properly. So my first question, and I'm not going to take anyone, please be honest, please do not go ahead and take the answer if you've already been part of the Insta session, which was there 1 hour before. So first question coming up, the biggest the biggest organ of the human body, or the largest organ of the human body is, you can answer that in 1 word below, which is the largest organ of the human body, and it will be, we are counting 5 now. 5, 4, first one to answer gets a free consult. 3, 2, 1, 0. Come on people, largest organ of the human body. Someone can answer. There are some doctors also who are there on the line. Rahul, I'll tell you about the book. Let's ask this question first. Skin. Shabnam is right. Shabnam, skin is the largest organ of the human body. You can drop us a DM, a direct message on our page after this, and we will give you a free consult coupon. You can come into any of our centers in Mumbai, Hyderabad, Kolkata, Delhi, Bangalore to consult us, and we will be happy to take care of you. Shabnam, thank you so much for your answer. Now, the next question is are all tattoos the same when it comes to removal? Meaning, are some tattoos harder to remove than other tattoos? And if certain tattoos are harder to remove, which colors are the hardest to remove? Please tell us that. So again, your time starts now. 5, 4, 3, 2, 1, 0. Anyone? Which tattoo colors are the hardest to remove? That answer is already given, Zuri. Skin was the answer. White. No, Madhurima, sorry, it's not white. Which tattoo color is the hardest to remove? Aarti, it's not liver, it's skin. Shabnam says yellow, but Shabnam, you've already won a free consultation. Black is not correct. Red, yellow and orange. Madhurima, you already answered once. Sorry, we can't take that. Sorry, we've run out of time. So, not all tattoos are the same, like I said. Red, yellow, orange and white are the most difficult tattoos to remove. Please pay attention to our Facebook pages. We'll be giving you more information over the next couple of weeks, and we'll be doing this Facebook live sessions much more regularly. Thank you all for attending. Thank you, Nidhi, for participating. Please follow Nidhi if anyone wants to be a cabin crew or wants to know a little bit more about how to take care of your skin, etc. Nidhi Belani is a very, very well-known celebrity coach from Singapore. She's got an Instagram page. She's got a Facebook page as well. Please go like her, and then let's take care of that. Shabnam, please write in to us. Thank you all. Thank you for your love. Hope everyone's staying safe during the lockdown, and hope we can contribute in some way to make your skin and everything look better. Bye, everyone.